Will there ever be a cure for cancer? Is there one now? What hope exists in the right now for cancer sufferers? None of this is medical advice. Cancer, the dreaded disease that takes millions of lives every year, has been a topic of concern for decades. Despite significant advancements in medical science, cancer remains one of the most challenging diseases to cure. The mere mention of it is enough to send shivers down our spines. But with ongoing research and innovative treatments emerging, there is hope for cancer sufferers. In this blog post, we will explore the current state of cancer treatment and answer the burning question: will there ever be a cure for cancer? Is there one now? So let's dive deep into this topic and uncover what hope exists right now for those battling cancer. What is cancer? Cancer is a term that describes abnormal cell growth in the body. Normally, cells grow and divide to form new healthy cells as old ones die off. However, cancer cells continue to divide uncontrollably and can invade surrounding tissues or spread throughout the body via the bloodstream or lymphatic system. There are many different types of cancers, each with their own unique characteristics based on where they originate in the body. Some of these include breast cancer, lung cancer, prostate cancer, colon cancer, and leukemia. While some cancers may be caused by genetic factors or inherited mutations, others may develop due to environmental factors such as exposure to tobacco smoke or radiation. In most cases though, there is no single cause for developing cancer. Symptoms of cancer can vary depending on its location within the body, but common signs include unexplained weight loss, fatigue, persistent coughing or hoarseness in voice among others. Early detection is crucial for successful treatment, hence it's essential that we remain vigilant about our health and stay informed about any changes occurring within our bodies. What causes cancer? Cancer is a complex disease that can have multiple causes. In most cases, cancer occurs when cells divide and grow uncontrollably, forming a mass of abnormal tissue known as a tumor. While the exact causes of cancer are not fully understood, researchers have identified risk factors that increase the likelihood of developing certain types of cancer. One major cause is genetic mutations or alterations in DNA that disrupt normal cell growth and division. These mutations can be inherited from parents or occur during an individual's lifetime due to environmental factors like exposure to radiation or toxic substances. Other risk factors include lifestyle choices such as smoking, excessive alcohol consumption, poor diet and lack of physical activity. Exposure to infectious agents like human papillomavirus, HPV, and hepatitis B and C viruses also increases the risk for some types of cancer. While it may not always be possible to prevent all cases of cancer, taking steps to reduce your risks by making healthy lifestyle choices can help lower your chances of developing this disease. Is there a cure for cancer? Cancer has been a scourge on humanity since ancient times, and over the years, there have been many attempts to find a cure for this devastating disease. Unfortunately, despite significant advancements in medical science, we are yet to discover a definitive cure for cancer. However, that doesn't mean that all hope is lost. Although there isn't one single cure for cancer yet, there are many treatments available that can help patients manage their symptoms and prolong their lives. Treatment options vary depending on the type of cancer and how far it has progressed. They include chemotherapy, radiation therapy, surgery or biological therapy. Some cancers such as testicular cancer have excellent treatment outcomes and high survival rates when detected early enough, while others like pancreatic or liver cancers remain among the most challenging to treat with low survival rates. Despite these challenges, researchers continue to look for better ways to diagnose and treat various types of cancers through ongoing clinical trials which offer new drugs, therapies coupled with innovative approaches like immunotherapy, which stimulates the immune system's natural defenses against cancer cells. While we do not currently possess a single universal cure-all solution for curing all types of cancers completely, progress continues steadily towards more successful treatments every day, offering renewed hope and opportunities at beating this terrible disease sooner rather than later. What treatments are available for cancer? When it comes to cancer treatment, there is no one-size-fits-all solution. Treatment options depend on various factors such as the type and stage of cancer, the patient's overall health, and personal preferences. Surgery is a common treatment option for localized cancers that have not spread to other parts of the body. During surgery, doctors remove the tumor along with surrounding tissues. Radiation therapy uses high-energy radiation to kill cancer cells. It can be used alone or in combination with other treatments like chemotherapy. Chemotherapy involves using drugs to destroy cancer cells throughout the body. These drugs are usually administered intravenously but can also be taken orally or through injection. Immunotherapy helps boost a person's immune system so that it can recognize and attack cancer cells effectively. This form of therapy has shown great promise in treating certain types of cancers such as melanoma and lung cancer. Targeted therapy involves using drugs that specifically target unique features present in certain types of cancer cells while leaving healthy cells unharmed. Clinical trials offer patients access to new treatments that are still being tested by researchers before they become widely available on the market. It's important for patients to discuss all potential treatment options with their healthcare team so they can make an informed decision about which approach best suits their individual needs. What is the prognosis for cancer patients? The prognosis for cancer patients can vary greatly depending on several factors. The type and stage of cancer, as well as the patient's overall health, age, and treatment options all play a role in determining prognosis. For some types of cancers such as skin or prostate cancer, the prognosis is generally good if detected early. However, for other types like pancreatic or lung cancer, the outlook may be more grim even with aggressive treatments. In addition to medical factors, psychological and emotional support can also impact a patient's prognosis. Patients who have strong social networks and positive outlooks tend to fare better than those who lack these resources. It's important to note that every case is unique and there are always exceptions. Some patients defy odds and survive longer than expected, while others do not respond well to treatment despite best efforts. Therefore, it's important for patients to work closely with their healthcare team in order to determine an individualized treatment plan that takes into account all aspects of their situation. How can I prevent cancer? Cancer is a disease that has affected millions of people around the world. While there are treatments available for cancer, prevention is always better than cure. Here are some ways you can reduce your risk of developing cancer. Firstly, maintaining a healthy lifestyle is key to preventing cancer. This includes eating a balanced diet with plenty of fruits and vegetables, exercising regularly, avoiding smoking and limiting alcohol consumption. Secondly, protecting yourself from the sun's harmful UV rays can also help prevent skin cancers. Make sure to wear protective clothing and use sunscreen when spending time outdoors. Thirdly, regular health checkups including screenings for breast and cervical cancers, for women, or prostate cancer, for men, can help detect any potential problems early on. It's important to be aware of any family history of cancer, as genetics can play a role in increasing one's risk. By taking these steps towards prevention, you are not only reducing your own personal chances but encouraging others around you to do the same. Are there any new treatments on the horizon for cancer? The field of cancer research is always evolving, and scientists are constantly working towards developing new treatments for the disease. One promising area of research involves immunotherapy, a type of treatment that harnesses the body's own immune system to fight cancer cells. One approach to immunotherapy involves using chimeric antigen receptor (CAR) T-cell therapy. This treatment involves taking a patient's own immune cells and genetically modifying them to target specific proteins found on cancer cells. The modified cells are then infused back into the patient's body, where they can seek out and destroy the cancerous cells. Another area of active research is targeted therapies, which focus on drugs that are specifically designed to attack cancer cells while leaving healthy tissue unharmed. These therapies work by targeting specific molecular pathways that play a role in tumor growth and survival. Researchers are also exploring new ways to use radiation therapy more effectively. One approach being studied involves combining radiation with other types of therapies like chemotherapy or immunotherapy in order to enhance their effects. While there is still much work to be done before these new treatments become widely available, they offer hope for those who have been diagnosed with this devastating disease. What can people do to prevent cancer? Cancer is a disease that can be prevented by making healthier choices. Here are some ways to prevent cancer. 1. Maintain a healthy weight. Being overweight or obese increases the risk of several types of cancers, including breast and colon cancer. Eating a balanced diet and staying physically active can help maintain a healthy weight. 2. Don't smoke. Smoking is one of the leading causes of lung cancer, but it also increases the risk for many other types of cancers like bladder, liver, kidney, and more. 3. Limit alcohol consumption. Drinking excessive amounts of alcohol can lead to liver damage as well as increase your risk for various types of cancers such as breast cancer. 4. Protect yourself from sun exposure. Skin cancer is caused by exposure to ultraviolet, UV, rays from the sun or tanning beds. Wearing protective clothing and sunscreen on exposed skin can greatly reduce this risk. 5. Get vaccinated against certain infections. Some viruses such as HPV have been linked with an increased risk for cervical, throat and oral cavity cancers, while hepatitis B virus has been found linked with liver cancer. By following these simple steps, you will not only decrease your chances of developing different kinds of cancers but also improve overall health in general. Conclusion. Cancer is a complex disease that affects millions of people worldwide. While there may not be a single cure for all types of cancer at this time, there are many treatments available to help manage and even eradicate the disease in some cases. Additionally, ongoing research into new therapies and prevention strategies continues to provide hope for those affected by this devastating illness. While it's important to stay informed about the latest advancements in cancer treatment options, it's equally crucial to take steps towards preventing cancer from developing in the first place. This includes adopting healthy lifestyle habits such as eating a balanced diet, exercising regularly, avoiding tobacco products and excessive alcohol consumption, and getting regular checkups with healthcare professionals. Ultimately, until a universal cure is found for all forms of cancer, early detection through screening tests remains one of the most effective ways to minimize its impact. So if you're concerned about your risk or have any symptoms that worry you, don't hesitate to talk with your doctor right away. Early intervention can make all the difference when it comes to fighting this challenging condition.